On behalf of the team at the Forum for Healthcare Strategists, Jen, Judy, Debbie, Krista, and me, Daniel Nyman, as well as our partners at Digital Health Strategies, welcome and thanks for fitting us into your busy schedules. We know this time is especially precious as you deal with the many issues surrounding COVID-19 and begin to look ahead to what comes next. Right now, we think the best thing we can do for you is to provide real-time information from your expert friends and colleagues across the country. To that end, we've turned to some of the best and brightest to talk about what they're seeing, hearing, and experiencing, and to offer advice and insights for rebuilding marketing and communications for post-COVID world. The conversation will be led by John Simpson and Ben Texter of Digital Health Strategies, and will include Jeff Bean from Geisinger, Christine Clay from Scripps Health, Pamela Landis from Hackensack Meridian Health, and Kathy Smith from the Johns Hopkins Hospital. Looking ahead, the forum has additional opportunities planned to help you navigate through the pandemic and beyond. We hope you'll join us for the Healthcare Marketing and Physician Strategy Summit, which has been rescheduled to August 17th to 19th at the Swiss Hotel in Chicago. We'll be sharing all the details soon. We'll also be starting regular Zoom chats for forum members. Stay tuned for more information. With that, I'll turn the program over to John Simpson. John?
Thank you. Hi, everybody. This is John Simpson from Digital Health Strategies. And so to kick things off, wanted to just do some brief introductions. I know Daniel talked about who's joining us, but just to give a little more detail, I'm the president and co-founder of Digital Health Strategies, and joined by Ben Texter, who's my partner and other co-founder. And we are a communications data and technology firm based in Washington, D.C., and we work exclusively with healthcare providers on patient engagement, employee and physician engagement, as well as foundation fundraising. And today we're joined by an esteemed panel of our most favorite clients. And just to quickly run through those, we have Jeff Bean from Geisinger, which is one of the largest rural health systems in central and northeast Pennsylvania with over 13 hospitals. Pam Landis from Hackensack Meridian Health, also with 13 plus hospitals, I believe, serving almost 70% of the population of the state of New Jersey. Kathy Smith from Johns Hopkins, which includes 6 hospitals and serves more than 3 million patients throughout Maryland and other states in the Mid-Atlantic. And then Christy Clay from Scripps Health, with 4 hospitals across 5 campuses throughout San Diego and Southern California. And in terms of our discussion today and our agenda, we have 2 parts, and we have some slides to share. We're going to get through those in about 25 or 30 minutes and give you all a chance to hear directly from your colleagues and ask questions. So there's a Q&A tool where you can type in questions. So please feel free to ask questions throughout, and we'll have dedicated time at the end so we can have a discussion there. But as far as what we wanted to share first is quickly to provide just some context. I think we all know why we're here. Probably no one would choose to be having this discussion, but we want to give up some background on where we are today, what we're facing, and what the opportunities are to best engage your patients, customers, and employees, and then hone in on 4 main areas. So the first is messaging and thinking about how you can evolve your COVID-19 messaging as you begin to open back up and invite non-COVID patients back into your facilities. Looking at targeted patient marketing and communications, your physician and internal communications, as well as broader brand and PR campaign opportunities. So with that, I'm going to pass it over to Ben to kick it off with some context on why we're here.
Hi, everyone. So I know the name of the presentation is about rebuilding after COVID-19, but I would say what we're really here to talk about is how does healthcare marketing operate in an era of ongoing COVID risk, knowing that it isn't going away, at least in the near term. You know, our infection rates and deaths across the country are going to vary geographically for some time. And I think we're all familiar with the phrase, you know, all healthcare is local, and that's never been more true than now. You know, For example, we're seeing declines in new COVID cases in New York, New Jersey, and Massachusetts, but we're seeing increases in new cases in Illinois, Texas, Nebraska, and Kansas. The truth is we're going to be dealing with COVID for some time. So the question is, how do we adapt? I think there are 4 considerations that we'll touch on in this presentation. We're going to need to learn how to deal with COVID and other medical conditions at the same time. So how do we bring patients back in so we can treat their other medical needs? And how do we make them feel safe, knowing that we'll be treating COVID patients as well, likely? How do we also make our employees and caregivers feel safe coming to work? And how do we help them adjust to the new normal? How do we act as a trusted source on an ongoing basis for COVID information and also reinforce federal, state, and municipal guidelines as COVID trends change? And how do we operate in a new era of uncertainty and have pre-developed emergency response and rapid response campaigns and assets in place should COVID return, or increase in our communities? And that's what we're going to talk about today. So the first important topic here is safety. And what we're really recommending is surround sound safety. This is the biggest concern of patients on a variety of surveys that have been put out, and should be your #1 priority. And I think it's important to get a system-wide safety message in place as best you can. And I think marketing and communications can really be the catalyst to make this happen. Right now, for a lot of large health systems, and it's understandable, we're seeing some variation in safety standards being implemented from hospital to hospital and clinic to clinic. However, it's important that your safety messaging be uniform across your system as much as possible, and that's because patients want to know they're safe with you, regardless if they're visiting a primary care doctor, a specialist, they're going to your urgent care, or getting admitted to the hospital. So some things to consider are, obviously, we know there are going to be limitations around testing to some degree, and so clearly articulating who gets tested. Is it people that are being admitted as inpatients? Is it people who are having scheduled surgeries or procedures? Is there a criteria list of symptoms? Is it at the doctor's discretion if someone requests a voluntary test? So articulating that, everyone wants to know that you have tests available, but the reality is you're going to have some limitations around it, and then balancing that out with screening messages. The one thing we can all do is screen patients. We can all temperature check and ask about symptoms. So there's a way to kind of balance the testing and screening message. And then on top of that, I think calling out the list of other things you're doing, isolating COVID cases, reinforcing that all caregivers are wearing PPE, reinforcing the fact that all patients are going to be required to wear masks, showing people how you've reconfigured your waiting rooms and your spaces to accommodate for physical and social distancing, showing people how your EVS teams are ensuring your surfaces are all sanitized in your clinics and your hospitals. I think one other important point here is the more we can show, not tell, is really important. So imagery and photography that reinforces these safety protocols is going to be important. In terms of looking forward, we're kind of recommending a phased approach here. #1, I think there's three general things that we're talking about in terms of getting people back in the door for their other medical needs or promoting telehealth. #1, we want to shift COVID-19 messaging to be a little bit more hopeful and helpful. It's been understandable that a lot of messaging has been alarmist to date, and that's completely understandable, but we want messaging to shift to more hopeful and helpful messaging. I think the second thing is really investing into targeted marketing campaigns so that you can get patients back in the door who have had canceled appointments, who maybe are lapsed patients who have been with you for the past 6 to 18 months, past ED visitors over the past 12 months, people with chronic conditions. So starting to triage and target those patients to come back in the door. And then finally, we can't forget about our internal people. So making sure that our physicians, our providers, and our staff are well aware of the marketing efforts that we're putting into the market. And then I think once you shift your messaging strategy, once you run your targeted patient marketing campaigns and make sure that your physicians are all aware of this, then you can expand and build on that down the road. Another way to look at this is really first focus on your internal teams, getting them ready and prepared as you rebuild surgical procedures, ED visits, and outpatient care, and then start recruiting back your current patients in a targeted way. You know, if you don't do this, you risk losing market share. For example, if someone had a canceled heart procedure that they needed and you haven't communicated with them that you're open for business, they're likely going to seek care elsewhere. And then open your message up to the community and show people how you're delivering safe care for both COVID patients and those with other medical needs. I think the important thing about these concentric circles is that the groups influence each other. If your internal teams feel safe to seek care, then they'll tell their friends and family. And if your existing patients feel safe to seek care, then they're going to tell other members of your community. All right, so in terms of the data, I think everyone on the phone probably knows that hospitals have a great reputation right now. I think not only do they feel like providers are doing a great job handling the situation, but they also trust you as a source of information. And that means going forward, you have the opportunity to take advantage of this sentiment by continuing to communicate and engage with patients, community members, employees, and the media as the best source for all things COVID-19 related and medically related. I think an important point to call out here is that when people are thinking about their hospitals, they're really thinking about their physicians and their nurses. So using them as the voice of your organization as you push out messaging, whether it's safety or topics around seeking other medical care, that's going to resonate the best with people in your communities and your patient base. And then, as I mentioned before, I think there needs to be a general shift towards a more helpful and hopeful tone. In terms of content, you can be helpful by letting people know about safety measures in place, how and where they can get tested, when to go where for care, televisits versus the ED versus urgent care versus their PCP, creating a return to the new normal checklist that takes into account both medical needs but other needs your patients might have, and then obviously continuing to update people on COVID cases. And we can be hopeful by highlighting the number of COVID patients we've saved, highlighting survivor stories, hero highlights, and COVID myth busting. So on this next slide, you can see these are two organizations. Piedmont is on the left, and they have very helpful information, on the left. They have very helpful information, how to protect yourself and loved ones, visitation information, FAQs, and on the right, you'll see Northwell's hopeful messaging, patient saved, healthcare heroes. I think a blend of these two is ideal as you shift your messaging forward, depending upon where you are in your state. So most of you are already probably starting your rebuild or your resumption to the new normal plans. Depending on your state's elective directives, there are probably three general considerations in terms of reopening. How profitable is the service line? How essential is it? And then do we have the staff and equipment we need to reopen? I want to talk a little bit more about number two, since many of you may be in states that are not opening or reopening fully elective procedures yet. There are generally three groups of procedures, urgent procedures, semi-urgent procedures, and fully elective procedures. And for those that can't perform electives yet, or even just worried about public relations components of this, your semi-urgent procedures will probably be the focus of most of your work. And typically these are defined as procedures that if left untreated for 90 days would cause significant pain, a progression of the disease, or a disruption to daily life. These might be things that, like high priority hip and knee replacements that are causing a lot of pain, or certain heart procedures like TAVR and others. So I think it's important to work with your clinical teams to identify these priorities by region, because they may vary within your own health system geographically, and then create targeted communications to patients with canceled appointments and lapsed patients that fit into those categories. From a messaging perspective, there are 3 high-level messages of focus. First, say thank you. Thank your caregivers for their sacrifices. Thank your community for flattening the curve. Thank your donors for stepping up. Remember that fewer people got sick, fewer people died, and you're able to resume some sense of normalcy because everyone chipped in and did their part. So thank them. Next, you're going to need to continue updating your community about COVID, while also ensuring people are getting the care they need. And this isn't just from a business perspective, it's from a public health perspective. We don't want people, dying of strokes and heart attacks more than COVID, simply because they didn't understand that it's safe and okay to seek care for other medical conditions. And finally, safety, safety, safety. You want to be the safest place people can go to seek care, so you need to communicate it everywhere. And here's a wrap-up checklist of things we've reviewed so far in this presentation in terms of external communications. In terms of facts and information, there's the obvious stuff, but I would also think more broadly, think about how you can help your community holistically, resources for small businesses who don't know what to do with regard to testing and screening employees and social distancing, questions about telehealth, wellness topics like how to eat healthy delivery food, how to work out at home when gyms start limiting capacity. I think obviously highlighting how and where to get tested and what the criteria is. We've talked a lot about safety, so that's certainly a big area. Preventive care is obviously just as important as addressing acute medical issues. So show people how taking care of yourself and getting your annual checkup can help you stay healthy and put you at a lower risk for disease progression or disease in general, including COVID. And obviously marketing your priority urgent and semi-urgent procedures and educating people about ongoing public health and safety needs is going to be important as well. John?
All right, so as we think about your physician and internal audiences, as Ben mentioned, you should be looking at these in parallel, or arguably even before your targeted patient outreach, for a number of reasons. So along with your patient communications, you need to have a plan for how you're communicating and how you're engaging with your teams of employees, caregivers, and physicians. Similar to the patient population, one of the top priorities is educating employees about your policies related to safety as they return to work. Certainly with frontline staff, we've seen surveys from state nurses associations and nursing unions that in particular, a significant percentage of nurses don't feel safe or equipped to perform their duties, or are concerned about the availability of PPE as they return. So really honing in on that. And I think that the messaging here is not just about things like PPE and physical safety, but also the other resources that you're providing related to mental health, given the stress across all of your teams, so that all of your employees are educated and feel confident about what you're doing to keep them physically and emotionally safe and well during this time. And then obviously the other educational information around new workflows or policies that they need to be aware of as they come back. The second area that Ben talked about a bit, and we'll touch on in a little more detail, is celebrating your caregivers. We're seeing that the majority of health systems that we work with and that we're seeing across the country are doing this, but continuing to really build on that and make sure that your employees know how much you value them and how much the community does. A third area, which we'll talk about as well, is prioritizing your providers. So with your targeted patient marketing campaigns, this is an opportunity to partner with your providers, your certainly leadership, as well as other frontline physicians, to develop these plans, make sure they're aware of them, and then be reporting out to them on a regular basis about the appointments that are being rescheduled, the new leads that you're bringing in, and really elevate the role of marketing within the organization and with your physicians in particular. And then finally, your employees are also your patients. So you want to make sure that you're educating them about how to stay healthy, not putting off, any care that they might need, and encouraging them to, safely and appropriately use your services. So if we think about celebrating caregivers, as we mentioned, this is something that is happening a lot, but devoting the resources to honor the efforts of your staff, not only your frontline teams, but also those that are behind the scenes. Encourage participation from the community so that your teams are hearing from their patients, from the people that they're directly caring for, and then aggregating all of this in a centralized place. So here we have some examples from members of the panel across Geisinger, Scripps, Hackensack Meridian Health, and Johns Hopkins, just showing some different ways that this can be done using photography, video, and other sort of interactive mediums. And one thing to call out here is that this content can really lay the foundation for brand campaigns. So as you look ahead, there's so many amazing stories that you're going to be capturing that can help tell your brand story as you move forward. From a provider perspective, we just talked about engaging them in service line marketing. There's going to be a lot of other information that physicians need, and this encompasses everything from new protocols for how patients are handled in the ED or in a clinic. There are new signage that they may need to put up in their clinics or in their offices about visitation policies. So how can you make that as easy as possible for them to get? You're going to have more people now than ever that are accessing your platforms remotely. So having a centralized, we might call it digital front door, is really critical so that it's really easy for your clinical teams to access this information and make it easy for them to access, but also share with others on their teams. And when you think about pushing this information out, so if you're working towards sort of a centralized hub or a destination, you really want to tap into all of the communication channels that you have available. So certainly things like your web presence through an intranet or external web pages, email lists that you have access to. Those are all great ways to send out both broad-based messaging as well as targeted messaging. But also looking at things like your leadership and town hall communications. A lot of our clients are doing virtual town halls, and many of you probably are as well. So how do you use that as an opportunity for two-way communication and hearing back from your physicians and employees, but also providing easy to use and easy to distribute resources that leaders can use to push out to their team. So as an example, here are the 5 things you need to know this week, or here is the safety checklist that you should be aware of, so that a team leader or a shift leader can easily access and pass that on to their teams in huddles or even forward on through digital channels like email. So from a brand and PR perspective, just to sort of reiterate what we've been saying, we certainly from a strategic standpoint recommend that the priority right now is on targeted efforts first and foremost. So looking at your internal teams, looking at existing patients and customers, and making sure that you are communicating with them and letting them know about what's open, what the safety protocols are, and what's available to them. But you also need to be thinking ahead for brand efforts and brand building. One thing that is becoming more and more available are statewide efforts that are being put in place by state hospital associations. So this is an example from California, We know Washington State, Massachusetts, and others are doing this. So check with your state hospital association and see what resources and content and tools they have, because these can create a quote unquote air cover campaign that has similar messaging and helps support your efforts, allows you to stay targeted, and it also helps you not have to invest a significant amount in paid media or paid advertising in the interim as you're building out a more robust brand strategy. And then as far as the brand building, I mentioned this before, but really building on the employee recognition that a lot of you are doing currently. As everyone knows, within a health system, your people are your product, and now more than ever, they are and should continue to be the face of your brand. And really thinking about how can you humanize your hospital and use these stories and use these amazing individuals to represent your brand. Another thing here is really highlighting the role of the hospital or health system in the community. So we're seeing on the philanthropy side an incredible outpouring of support, financial support, as well as donations of supplies. I think everyone on this call is seeing the same thing. So how can you highlight that as well, and saying we are all a community that's supporting healthcare, and everyone's playing a role, whether that's individual donors or businesses. But this also underscores the critical role of hospitals in the community. And there was just recently, yesterday, an article in the Washington Post about the financial challenges of health systems, and not only in terms of people accessing care, but also, how much of a part of the economy hospitals are. And I think people don't necessarily realize that. So this is a way to further build that out. But I think the main takeaways here are, continuing to have your people be the face of your brand and underscore that role that you play in your broader community. And when you think about the media and from a PR perspective, when we look at all these surveys, national and local media aren't being trusted as much as you all are, but there's the ability to partner there, to get your messaging out there, to use your clinical leadership as a voice. And so I think that there's opportunity, perhaps now more than ever, that the media is looking for sort of these expert perspectives and on the local level, and that can only help to support your brand. So we'll shift now to the panel discussion phase. We have about 30 minutes. And if everyone looks down to the bottom of the screen, there's a Q&A button where you can type in a question. So one question, I'll sort of moderate this portion, but one question that I'll shift out to maybe Jeff, to you first, is, are you seeing, when you think about any advertising efforts that you're doing right now, has your media mix shifted significantly? Are you seeing digital as even more of a priority than maybe it was before? As you look at your targeted efforts, how are you thinking about your media mix model?
Yeah, thanks. Thanks, John. And thanks everybody for logging in. We are a digital first shop. And so we're actually kind of blessed that this is happening, because it's really, I think, opened the lens for the organization to see the value of digital and the value of being able to measure what we're doing and where we're investing. And so as we look across our markets, and we do have rural, but we also do have some urban in Northeast Pennsylvania with a lot of connectivity to New Jersey and New York. Folks actually commute over the Poconos, but we are shifting money to digital. We are shifting money to more money to search, but also to programmatic. Even though we know that's not lead gen, we see it as a valuable brand play. And then we're also looking at, in our markets, very targeted spot cable, which is very low cost, and it allows us to run our PSAs in both English and Spanish. We can target by demographic, and we're running those around the clock because we really wanted to simplify this pretty complex situation. I mean, you get to the question of how much is too much, and it's constantly changing. And so when you're advertising or you're trying to communicate out through earned media, you can change on the fly, but when you're placing media and you're putting creative assets in the market, you have to be really careful about putting out something that you can ride for a while before it's turned upside down by some policy or some new action taken out of DC or out of state houses.
Great. Any other folks, Christy or Pam or Kathy, anything else you might add for that question around your media strategy?
Hi, it's Pam Landis. Thanks, John. And thanks everybody for joining. A couple of things I wanted to say. I know we're all exhausted, and I think it's only what Ben talked about a little bit. We're not really in post-COVID. We're going to live with COVID until there's a vaccine. And let's remember, the fastest time we've ever gotten to a vaccine to market was 4 years, and that was with the mumps in the 1960s. So it's going to be a while. What I say is, I'm a person that sits, I report to a CIO and a chief strategy officer. So I try to straddle operations, technology, strategy, and marketing. I think that digital, what we've learned here in the last 60 to 70 days is, how many of your doctors out there never wanted to do video visits and then we couldn't get video visits out fast enough to them? I think that we saw a real pivot point happen here as things moved to digital tools. That virtual care is not virtual, it's just care. It's not video visits, it's just a visit. And I think that pivot that we all wanted in the last few years has started to come about. So I'm sorry, I have to go upstairs to another call to actually present the research on where we're going with COVID-19.
Great. No, thank you, Pam. Another question that came in, and Kathy, I'll maybe pose this to you to start, and then Christy might be helpful to you. Obviously, every health system has a very diverse market and set of customers or patients. But is there anything, Kathy, that you're doing around different ages, or thinking about how do you communicate with a 55 or even 65 plus audience right now versus a younger audience or different ethnicities? Have you been thinking about that, or is there anything that you're working on that might be good to share with the group?
Sure, thank you. And thank you to all who have joined in today. Appreciate being here. One of the ways we've been addressing that is through our content development. So all along from day one, when we were faced with this, we started to build out COVID resources through content generation on all kinds of topics that are related to lots of different audiences. So we've built out a pretty robust resource center on our public website where we're continuing to develop content around information that people can trust Hopkins experts for, whether they come to us for care in the past or now or in the future. So we do have a variety of topics that we continue to iterate on that are related to people in older age, to parents, pediatric content, caregiver content, and personal lifestyle content. It's been a way for us also to really bring out not just our infectious disease experts, but to find ways that our experts across the system can be helpful, particularly related to behavioral health, even fitness and nutrition, even our psychiatrists that deal with relationships and sexual health. So we've been developing a lot of unique content on our website. And then, as Jeff said, it's even more important for us to have the ability to target and to segment. And we've been doing that through amplification, through our social channels. And then I will say that from a digital standpoint, it's interesting to see the research where email has really moved up to the top of the list in preference for a channel, whereas in the past it might have been much further down. I will say that through this period of time, we have found that we have a lot of work to do as it relates to email communication. We are not as sophisticated in opt-in email as we need to be in order to reach our patients directly. So we can do a lot with targeting to lookalike profiles, to various segments of the public, but we are in a position now to really ramp up what we can do for this crisis as well as future crises in more sophisticated email capability.
Great, thank you. Christy, anything else that you would add around that topic?
Sure. Thank you, John, and everybody for joining us today. Much like Kathy was saying, we actually have had a very robust content marketing strategy for a couple of years now. But with the COVID situation, we made a radical shift so that everything on the content side was related to thinking about our audience, the segmentation of that audience. We are close to the border, so we have a significant Spanish-speaking audience, so we have pushed content out in Spanish and in English. And that includes content related to the resources that we have here as part of Scripps Health, and also content, again, getting into the hearts and minds of our community, and that includes different age groups too, with a number of different articles. At the same time, and I was glad that Kathy touched on the email situation, because we've used both MyChart or MyScripts to make sure that we're communicating to different audiences. So some of the communications that are going out, probably like many of you, are to the broader patient population of Scripps, but then we've also segmented that for pediatrics or for oncology patients, and we continue to look at what different groups of patients are needing along the way. So like others, you know, the COVID was an opportunity to really make a radical shift in a faster way than we ever anticipated, but it's good long-term for our patients in the community.
Great. One service line that I think most health systems will see as a high priority when we think about the categories that Ben talked about in the beginning for different service lines is cardiology. So Christy, I might actually throw this to you first, and then Jeff and Kathy, if you have anything to add. This is an area where, you know, telemedicine can still play a role, but there's certainly more of a need for someone to be coming into a facility if there's testing that needs to be done. Certainly if they have chest pain, obviously they need to come in to an ED. Could you talk a bit about what's, you know, knowing Scripps as the heart care leader in San Diego, what cardiology is doing right now, or how you're thinking about that service line in particular?
Yeah, sure. So like many organizations across the country, and it's been in the national media as well as here locally, we were seeing a pretty dramatic drop in the number of patients coming to our EDs and our urgent care. And that includes for cardiovascular, so both heart and both stroke. So again, really leveraging the content team and strategy, we started pushing information out, articles on why it was important to still come in for different medical conditions. It went out through social media. We also used our email strategy to get that information out, and then the media team also pitched some stories. So it's kind of been a full surround sound on that here. But at the same time, we had to be ready for patients to come in. I really, again, liked what Kathy was saying. These are visits. They're just not video visits. But make sure that our patients with chronic conditions, with comorbidities, and that includes cardiovascular conditions, there was outreach done to them by phone, encouraging them to come in when needed. So again, both on the marketing communication side and on the clinical side, we've really partnered to make sure that our patients, whether it was cardiovascular or other patients with difficult medical conditions, knew that we were here, the doors were open, and there were multiple ways that they could be seen.
Great. Jeff or Kathy, anything you wanted to add to that?
Yeah, happy to share that our telemedicine in particular, when we first launched, we were looking to launch in June, believe it or not. And of course, this created the opportunity to launch faster, which was a little harrowing for some folks on the operational side. But we first looked at specialty care. And so the specialty care was the volume coming out of the gate, and then we layered in primary care over that. But it's really important for us because we do have a population with a high number of chronic disease, diabetes, obesity, congestive heart failure, and it's really important for us to do it in the safest way possible. So keeping close tabs on folks through video visits. We like those over telephonic, although some folks want telephonic, but also working on ways to make sure that that they are not in an emergency situation and showing up in the ER and then it becoming a really, really difficult case. So our cardiology department and our volumes have not really changed much because I would say the patient mix, especially up in the Northeast PA, there's a real strong relationship there between physician and patient, and there's a lot of trust. And of course, heart is can be a very tricky situation. I mean, there's maintenance versus acute. And so we're trying to cover all the bases, but I'll tell you, telemedicine has been very important for us in that regard.
And this is Kathy. I would just say ditto. All of that is the same that we're applying. We're also really relying on the Hospital Association to do some public service announcement campaigns in this area. And then we're targeting through social audiences around the cardiac message. And we're ramping up now to have a more video show don't tell images around our emergency room, and we'll be doing so at a specialty level, including cardiology, as to what to expect and how to feel safe to come if needed for urgent care.
Great. There's a couple of questions that would be interesting to get everyone's perspective, but maybe Christy, starting with you, around relationships with major employers in your area. So knowing, in San Diego, there's Qualcomm. I know on Geisinger and the Hopkins side, similarly, there are large employers that are using your healthcare facilities or are covered on the health plan. Has there been work there, or could you speak to what your thoughts are for that audience, as well as individual patients or customers?
Sure. So Scripps actually has a unique relationship with Qualcomm. We have a co-branded health plan that's available to Qualcomm here in San Diego called the Qualcomm Premier Plan. And we have an ongoing strategy to recruit employees of Qualcomm here in San Diego into that program. We do it in close collaboration with the HR team over at Qualcomm. Part of that is we also have an ongoing engagement strategy. So we do monthly communications. We have events that we normally do over at the Qualcomm locations here. So what we were able to do during COVID, and we will continue to do going forward, is start to pivot some of the work that we were doing to make sure that we were communicating in collaboration with the human resources team at Qualcomm to make sure that all of the Qualcomm Premier Plan members and also those employees who also needed our support at Qualcomm had information. So we've really taken our core messaging and been able to push that out through Qualcomm. That includes through emails to Qualcomm Premier Plan members. We've also done a webinar. Our chief medical officer was able to do a webinar in collaboration with Qualcomm. So we're working closely there. And we also have relationships with other employers in San Diego through our contracting team. And we've kept the contracting team informed so that they're able to share that information as well.
Great. Jeff or Kathy, anything you would add about any larger employer relationships that you all have?
You want to go, Kathy?
Just to say that there's a separate division of Hopkins that actually manages employer health clinics in a number of large employers around the nation. And just again, going back to our effort to be a resource, they've been taking a lot of our content and repackaging that in ways that is relevant to that particular employer through that employee health clinic. So it's just a way for us to extend our reach of our resources and knowledge to help people get through this with the knowledge they need.
Kathy, I have a question for you. How do you envision destination medicine evolving over time, or have there been discussions at Hopkins for big brands that are obviously drawing people both nationally and internationally, and the impacts of this on that?
So I would say, obviously, there's going to be an impact since we're also dealing with, shelter in place as well as the travel industry in general with its own complications and issues. I think right now we're in the middle of a little bit of chaos that's forming due to states opening up at different times. So in Maryland, we already are surrounded by healthcare organizations in other states that are starting to open. So we actually will be interested to see how much travel for care there is during this interim period that's outmigration, uncharacteristic outmigration, because people perhaps are, more eager or anxious to travel across state lines to get care. So I don't have the answer, but absolutely it'll be interesting to see what consumer behavior is like. What we hear the most is consumers are going to more likely delay care, even coming back into their preferred provider. So it will be interesting to see what the patterns are.
Hey, Ben, Jeff here. We're a center of excellence. We provide joint replacement, spine, bariatrics for one of the biggest employers here in the US. And we are looking at reopening that from an elective surgery standpoint. I think if we do it right and we have all the protocols in place, we feel confident. We also have heard from the employer that they have a need. They're still in business, they're still operating, people are still buying goods, warehouses are still being managed, boxes are being moved, not everything is robotic and automated. So there's still a human factor here, and the machinery keeps moving. So we've been really closely in discussions with that employer to make sure that we service their needs as one of, I believe, 6, what they call centers of excellence. The other point around local employers, what we've done is made all our materials available. They're branded to our health plan member SMBs. We have mostly SMBs here, our commercial members who provide insurance to their employees. We've made that available, but we've also, on a community engagement scale, really reached out to all the business organizations, the chambers, and made those available for anybody who wants them in English and Spanish. And again, this gets back to the role that we serve as a really trusted source. People are looking to us. They know us, they're looking to us, they want to hear from us, they trust us. All the data that we see has the local healthcare provider in at least the top 3 in terms of trust. They're not looking to CDC or state of PA. They're really looking to us in our market. So we want to be there for them. And, we're really listening to them too and asking them what they are looking for, because if we're just talking at them, it's just a one-way conversation. So we've really opened up those lines, and we're listening very closely.
Thank you both.
Yeah, thank you. So shifting slightly towards physician engagement and communication during this time. I know some of this may fall outside of Christy, Jeff, and Kathy, your direct purview, but just around physician communications and normal channels. As an example, someone asked about physician liaisons. Obviously, having physician liaisons going out and setting up in-person visits with specialists is not really an option right now. but just hearing if there are other things that you're doing that have been effective in getting information out to physicians or keeping them engaged during this time, particularly those specialty docs that haven't been performing procedures over the past 6 weeks or so.
Yeah, John, I would tell you, based on our backlog, we're not going to have to market service lines. We had 71 campaigns running digitally before C19, and we put the brakes on the vast majority. I think with the exception of women and peds and a couple subspecialties that are fairly, I would say, low risk, but we're not too worried right now about volume just because of the backlog. We're actually more concerned, I think, around making sure that we take care of that backlog in a real prioritized fashion, because when you turn something off, you turn these health systems off. I mean, it's like any other business you turn off. It takes a while to get the machine back up and running. It's a dimmer switch, not a light switch. But our physician liaison team, we have 7 people that are out in the field working. They've been working mostly, we're all working from home, so they're mostly working digitally and virtually and doing Skypes and checking in. But we're not really pushing super hard at this point for necessarily referrals. We know they'll be there and they'll show.
This is Kathy. So to answer the question about channels, we have been having our physician leadership has been having weekly conference calls with large practices that are aligned with us, or all the practices, for example, that are based at one of our healthcare and surgery centers, to keep them in the loop and up to date, which has been very helpful, and they've appreciated that quite a bit. We actually are really concerned about volume. We have a huge backlog as well, but again, the consumer research is showing great fear and trepidation of coming back. So to your earlier point in the presentation, the marketing that we are doing and will be doing is really trying to influence the hearts and minds in not being scared. And that's going to be, I think, a huge road for many of us. So we have a huge backlog. We're hoping that when that starts to get worked, that rescheduling the right cases at the right time, at the right place will all fall into place. But it's going to be quite a journey to see how people respond and how quickly they come back or not.
Kathy, to build on that point, obviously I was talking a lot about safety, surround sound safety, but somebody had mentioned in the comments here on the Q&A that they're seeing health systems create a COVID-19 clean seal, almost like a good housekeeping seal approval. Have you seen these before or considered that?
I have not. We're not a big believer in buying seals of approval.
Yeah, I mean, I haven't seen it either. I was just asking.
So that sounds a little risky to me, because I don't think you can make an absolute promise that something or a place is going to be completely clean of this virus. So I would hesitate to put that type of seal on anything until more is known and we.
It seems like
a
lot of liability.
Yeah, Ben, the lawyers don't really like that, but look, everybody's following CDC protocol. So if we're all following the same protocol and we're all saying we're safe, we're all doing the same thing. And so for a consumer, they're going to hear the same thing. It's almost a shouting match. What we've developed is a little bug called Safety Check. And essentially, Safety Check is just a symbol, and it's associated with the list of the protocol of all the things we do and the things we do above and beyond CDC because of who we are and what we want to convey to our patients. So yeah, I don't underestimate the backlog and trying to get people back in the door. We know that's the biggest mountain to climb now is the whole safety and the concern and the fears. But yeah, a seal of, guaranteed seal's tough, but I think there are visual symbols that you can create, the lawyers can live with, and I think it's just it's a signal of this content is relevant to you around this particular topic, and I think there's a way to do that without putting yourself into harm's way of any liability or other things, because there are no guarantees, as we know in this world. There's one system that is in our service area that has talked about, not treating COVID-19 patients in a particular facility, I think. I haven't seen the actual ad, but I don't know how you guarantee that, because if somebody goes home or they're out in the store and somehow they contracted and they don't know and they're asymptomatic and then suddenly somebody's exposed, it's virtually impossible to guarantee anything.
And one of the ways that, this is Kathy, one of the ways that we've been trying to actually also show, not just tell, is by having an extremely micro focus on the images that we are using on our website and our outreach. We have created with our infection control partners a image guideline that all of our staff use, and we actually post it for employees to follow as well, hopefully, when they're posting on social. But we're really being vigilant about the imagery that shows our staff behaving in a safe way by how they're appearing, and to show them following the recommended guidelines in the workplace.
And this is Christy. I just want to add to what Kathy's saying is we have done the exact same thing. One of the things that we're looking at is how we transition going forward. And that has to be in line with the guidelines on attire and PPE. But I did want to add on the script side that we do know that we have a backlog of patients who will be needing to come in. We are concerned, like Kathy was saying, that they may not have the confidence. They may have the trust in us, but maybe not the confidence to return immediately. So we have a Scripps Listens patient community that allows us to go out and survey our patients as a cross-representation of patients throughout the system who've opted in to be part of this community. And one of the things we're planning on doing is starting to do more research with those folks to really understand their mindset and what they need to have that reassurance to come into the facility. At the same time, we're looking at more of that show, just don't tell. And that could even be sort of a virtual walkthrough of what it's like to come in to get your mammography appointment or some things like that. So how do we restore that confidence?
Great. We're about one and a half minutes until time. So a couple of things. Just wanted to again thank everybody. Thank Jeff, Kathy, and Christy for all of your great insights and input here. Everyone who attended. We didn't get to all the questions. There was a big outpouring of questions. So we'll gather all of those together and we can follow up with folks individually. We'll get all the questions from the forum team. And you'll also be getting a recording of this as well as the slides to refer back to if you'd like. But again, thank you to everybody there. You should get prompted to take a survey as you exit. Only positive responses allowed, but if you did enjoy it or if you have comments, all joking aside, please fill that out. It lets the forum team know what's helpful for you all. It helps us as well, so we can make sure that we're providing resources that you need. So thanks again. Good luck to everybody as we continue to move forward through the new normal. And yeah, hope everyone has a great afternoon.